Hi, I'm Dr. Marian Owen, and I'm coming to you from a backyard on April 5th, 2020. Got a few things to go over with my patients this week, so I just wanted to, before we get started, give you a little table of contents with time stamps on them so that you can jump to the things you're more interested in. So we're going to be talking about the new recommendations that people wear face masks in public. We're going to talk about the many questions I've had about how to safely bring products into your home, things that are delivered, things from the grocery store. I'm going to cover what to do if you get sick, what you do relative to us if you are feeling sick, testing availability. I have a quick correction of some earlier content that Susan and I put out about if people are sick in your home, what we want you to do. And then I have a brief appeal about the best way to communicate with the office during this time when things are a little bit shaky. So that's kind of the things we're going to cover, and now let's get started. So I want to start by extending the loving good wishes from all of our staff to you. We know that this is an extremely stressful time. We are under health fears, we are under financial fears, we are struggling to take care of children at home, or worrying about grandchildren we can't see, or worrying about older family members, or worrying about ourselves. And just there's so many things up in the air right now that we know you are all under a tremendous amount of strain. And on that note, I want to also extend my extreme gratitude to my staff, who is also experiencing that same strain, and they are showing up to work every day. They are pleasant, they are positive, they are there for you. And I just want you to know that we are doing everything we can to maintain whole family medicine intact and working strong on behalf of you. Quick update, so far we have no known positive cases among the members of our healthcare family. So as far as we know, none of our patients have a positive test for COVID, and that is great news. That means you guys are isolating, you're being careful, you're doing what you've been advised to do by all of the various healthcare agencies that are science-based, and we really appreciate that. So the first thing I'm going to go through with y'all is some myths and mysteries, questions that I'm getting asked a lot about kind of how to protect yourself during this time. And what I want to say is it is still true that the most important thing you can do is wash your hands. Wash your hands. When you go out, keep a social distance and minimize the number of trips you need to make and the number of times you leave your home. Those are the things that you can do that absolutely will decrease your personal risk of getting this virus. The new recommendation that we all wear a face mask. This was lovingly made for me by a longtime patient. Thank you, Happy. And these face masks that are cloth, what are they going to do? They're obviously not going to stop a tiny little micrometer viral particle from passing through this cloth barrier and entering my lungs, right? So what good are they? Well, the biggest way we get exposed, the largest known transmission source for this virus, is when there is a heavy load of viral particles on a surface. You touch that surface and then touch your face. So how does a mask prevent that? Well, the mask isn't to keep you from getting sick, it's to keep you from spreading it when you're out and about in public spaces. You do not need to wear these masks when you are out taking a walk. You just need to dodge around people far enough that it doesn't matter that you're nearby them. And 6 feet really does seem to be a reasonable distance from what we know about all the other viruses like this virus that we've ever encountered. So 6 feet space, you do not need to use it when you're outside. You do not need to use it in your own private home. And the point of it is to prevent you from coughing and having large particles of your respiratory spray hit a surface that then someone else is going to touch. And that's because you might be infectious before you know you're sick. So if everyone does this, everyone, not just you, but everyone does something like this, we're going to reduce the viral load for the whole community, and we're going to reduce transmission. So it does not prevent you needing to stay a safe distance from people. and it doesn't necessarily prevent you from catching it if someone were to cough and they don't have on a mask in your space, so you still need to give that distance, but it is a very reasonable and socially responsible thing to be doing. So again, thank you, Happy, for these, and I hope you all have a source for those. I know that there are people on Nextdoor that are making them. I'm sure if you ask, someone could provide you one. Next, I'm going to talk about bringing things into your home. Many of you have sent me a video from a doctor, I believe in Michigan, who has a kitchen counter with a tape on it, and he brings the groceries in to the clean space, and he talks about how to go from the clean space, the dirty space, to the clean space. And I want to say that I think that that is overkill. Now, if it makes you feel better to do those things, if it is soothing to you to be absolutely mitigating every bit of your risk, I think that's fine to do. I just simply don't think it's necessary. So again, I want to talk about this idea of surfaces and face contact. So if there is, say, you get a cereal box at the grocery store that someone has coughed on, that cereal box may in fact have a good bit of virus on it, right? So what we think that will live about 2 to 3 days. So you go to the grocery store, you've got your mask on, you do your shopping, you don't touch your face, you come home, and the first thing you do is put your groceries away, wash your hands. That cereal box with virus on it sitting on your cabinet shelf for a day or two before you use it, the virus load on that surface is going to very quickly drop down. And then when you touch it again, there won't be enough virus on that surface to be contagious to you. And if you wash your hands between preparing your meals and eating your meals, and you don't touch your face while you're making your meals, you're going to be fine. You don't need to do all of this sterilization of things as they move into your space. That really is overkill, and I think it's making some of y'all a little bit nutty. So just relax, the viral load will slowly go down. So the concept of viral load is, if my immune system sees 10 viral particles on the lining of my nose, like walking by someone within 6 feet outside, they're exhaling, I'm inhaling, and I get randomly somehow a few little particles from them, my immune system can totally handle that. The virus will start dividing, but there's only 10 of them, and my immune system can go, boom, let me get rid of that. And in fact, that may be the way we get to herd immunity, is through micro exposures like that. It's almost like a vaccination. The people that are getting really sick with this are healthcare workers. Why? Because they are in the face of the person who was coughing as they are doing procedures with inadequate protection on, either because they didn't realize the patient had COVID or because they are not provided adequate protection by the people they're working for. So in those cases, you're getting a huge dose, and you're not just getting it in your nasal passages or in your oropharynx. You are inhaling a huge dose of virus directly into your lungs, and now you're going to get really sick. But y'all aren't doing that when you're out taking your walk and someone jogs by and they're exhaling and you give them a 6-foot span and you're inhaling. You don't need to worry about that bypass exposure. Like that, if it's that contagious, we're all gonna get it tomorrow, and there's nothing we can do about it if it's that contagious. But it's not that contagious. It's simply not, or it would be everywhere already. So the viral load is the idea that unless you're like in a hospital room where someone has been coughing, or this cruise ship you've already all heard about where like 27 days later the virus was still detected. Well, it was detected, but was it at contagious levels? I doubt it. That room was inhabited for weeks by someone who was actively spewing virus all over the place. That's not the situation you, a healthy person in Georgia, is going to find yourself in. So you really don't need to worry about that. So go to the grocery store, wear your mask so that you don't spread it without realizing it, gather your groceries together, pay, stay that 6 feet away, be close as minimum time as you can to get that transaction done, and get out of there. Get home, unload your groceries, wash your hands. When you make your meal, prepare your meal, don't touch your face, then wash your hands. You're not going to get the virus from your food, and if you wash your hands before you eat, any residual virus that's on any packages that you have in your home is not going to get into you. That 20-second soap scrub is really effective. So that is my bit about bringing things into your home, and I hope that answers some questions. So let's move on to how to interact with us and what we're doing in the practice. Again, we so far know of no patients with a positive COVID-19 result. So far what we're getting is phone calls from people who are concerned they might be infected. And thank you for that. That is what we want you to do. We don't want you walking through the door. We don't want you home worrying. We want you to call us so that we can talk through your exposures, we can talk through your symptoms, and we can help you decide what is the prudent thing for you to do. So this year, for some reason, my allergies are bothering me a whole bunch more than usual. In fact, I would never have said the words "my allergies" before this year. But suddenly, I'm extremely aware that my nose is congested and my eyes are kind of itchy and burny. And I've never been aware of that really before this year. Is that because suddenly my allergies are worse? No, it is because these symptoms are scary, and the symptoms are scary, so they're getting the attention of that limbic system that I talked about in March, that part of the brain that's designed and whose job it is to keep me safe. So that limbic system's going, whoa, that's a symptom we think maybe we need to be worrying about, and it is making my consciousness very aware of my symptoms of allergy. But they are symptoms of allergy, they are disturbing, but they are not dangerous to me. And because I know that, I'm calming back down. If you're not sure of that, it is my job and Susan's job to help you know that. It's not your job to make that decision. Call us, let us walk you through it, let us see what's going on. So another thing that we're seeing a lot is people with underlying asthma or underlying anxiety who are, because of increased anxiety, breathing a little bit more rapidly. That's what adrenaline does. It makes you breathe faster. So as we're breathing faster from adrenaline, our brain is kind of getting the signal of, I'm working a little harder to breathe. And then you wonder, am I short of breath? Well, I assure you that if you're short of breath from an infection, you don't have that question, am I short of breath? You know that you are short of breath. So that feeling of just tightness in the chest, or like I feel like I'm working harder to breathe, before you worry about that too much, I want you to invite yourself to settle, to check what you're breathing from. Are you breathing from your diaphragm, dropping your breath into your belly and taking a long, slow inhale and a long, slow exhale? Or are you breathing up here more rapidly, more shortly, and therefore increasing the tension in your chest wall and your neck and your head, and making yourself feel, and of course encouraging your limbic system to worry that you may not be breathing well. So that is something we are getting a lot of calls about, a lot, and it's fine. We understand this is scary, but it's something we saw before this, it's something we'll see after this. We're just seeing more of it now that people are aware that shortness of breath is something they need to be monitoring themselves for. So if you are worried that you are not well, you call us. It is our job to help you. We are open every day at our regular hours. The phones start answered at 9. And then someone is there until 4 o'clock. They check the phones before they leave. We have got that system down more tightly. I know that that's been a concern of yours, getting questions answered over the phone, but I assure you that is something we're working on really hard, and my staff has stepped up, and we are doing a great job of that now. So call us, call us, call us. Call the office, please. The health department does have drive-through testing. You can't just drive up there and get it. The way you get to that is you call us, and we do a questionnaire that they have online that providers have access to, and we put you through their questionnaire. And if you check all the boxes you need to check, that your risk is high enough that your what we call pre-test probability of a positive result is high enough to make the test an effective test, that you will get a number, and then you will be told where you can drive to get your test. You can't take all your friends at that point. They're only going to do the one test for the one person that was sent by us. So now I want to talk about false negatives with that test. If we do the test and your pre-test probability is low, the sensitivity of that test is not great. So we're going to get a whole bunch of people who might get results that are not accurate. So we only want to test the people that have a high chance of being positive, or a high enough chance of being positive that a negative result is then meaningful. Because the negative predictive value is not great on this test. 30% of people who initially test negative later in the course of their disease are testing positive. So you don't want to be falsely reassured by a negative test. If you've got the symptoms of COVID and your test is negative, we're going to tell you to still act like it's COVID, because that's the socially responsible thing to do. But if we only send people for that test who have a high enough likelihood of being positive, or enough exposures that it's like possible that you might be positive, then we're going to have a better result from that test. We're going to know more information when we get it back. On the different treatment options that have been posted out there, and I want to say how much I appreciate how few of you have reached out asking for prescriptions for these untested treatments. That is the socially appropriate thing for you to be doing. You let us decide if your situation is bad enough that an unproven treatment is worth a risk for. And I'm going to say we're probably going to limit these more unproven things to people who have a very high risk of the disease in general, like if you're a healthcare worker and in the face of someone, if you have comorbidities, diabetes, hypertension, if you're very old, very old, if you're over 60, which isn't all that old actually, but especially if you're over 80 or even over 70 with comorbidities, that's when we're going to start thinking about, is it worth the risk of adding that medication for you? And we will have a long conversation with you about what is known in that moment, the best up-to-date information we've got about whether or not you're a good candidate for one of those interventions. When we put out a video earlier, Susan and I, we were saying, if someone in your family has symptoms of COVID, all of you should isolate. You've probably all been exposed. And that is true. In thinking back on that, I'm wondering if the impression we gave is that you needn't isolate someone who's very sick in your home. And going back to this concept of viral load, the amount of exposure you get is somewhat determinative of how sick and how quickly sick you might get. And so in that context, and given that information, it is reasonable if someone in your home is very ill to isolate them into a bedroom and a particular bathroom that they use, and then once they are well, to clean those spaces very, very well, not have them in the common spaces of the household. Yes, you probably all will get exposed, but if you get exposed with 10 rather than 10,000 viral particles, you are more likely to have a mild case of it. And so I want to make sure we get that correction out, and I'm sorry about that information earlier. So yes, you're probably all exposed and contagious and should assume yourselves to be and practice social distancing and all those things, but you should also limit your exposure to that virus so that you don't get sicker than you need to. A quick word about communicating with the office, and I'm going to put this in writing above. A lot of you, I think, through believing that you are trying not to bother us at the office, that we're very, very busy. One, I just want to assure you we're not very, very busy. We're kind of bored, so call us. But a lot of you are using my cell phone and texting small requests. And while normally that's okay and it's not that interruptive, because of the number of you that are doing that, it's actually being somewhat stressful for me. So if you have an issue that is not urgent, like we're closed and you're sick, that kind of urgent, but just, what time is my appointment? Or are you guys open today? Or I have a little shortness of breath. Do I need to be worried? I'd rather you not text me that for a few reasons. One is just my phone is on fire right now. I mean, I'm getting so many texts, it's hard to manage them all. But also, like at 8:30, I'm brushing my teeth trying to get to work. And you're quick texting me. I can't deal with it in that moment because I'm brushing my teeth trying not to be late for work. And then I forget it's there because that is who I am. I forget things. My short-term memory is crap. So That's why I always tell you, if you give me a sheet of paper, make sure I fill it out and hand it back to you before you leave, because I will lose that sheet of paper. I will lose everything. And so when you text me, because once I read it, the alert is gone, I am going to forget to manage your thing. And that stresses me out. So unless it's really urgent, please wait for office hours, email, portal, phone, whatever. Now, if you haven't heard back by the end of the day, text me, because then my staff isn't doing the work that I think they're doing, and I need to know that. But give them a chance. We're working on the systems, and I really think we have them down. So if you could do me that favor, I would really appreciate it, because that is the one thing that has been really hardest for me during this time, is how much y'all are using my cell phone to text me. So unless it's urgent, please try to not to. All right. Thank you so much. I hope that you are well. I hope that you are finding the silver linings that are out there. They're there. I did some watercolor the other day. I've never done it before, and I'm terrible, but I'm gonna do it again. I'm gonna get better. But it's just, you know, it's an opportunity to focus in, to be with your family, to remember who you love, reach out to them, pray, meditate, get outside in this beautiful, beautiful, beautiful spring. The birds, the squirrels, they have no idea this is going on. They're still doing their stuff. Go sit on your front porch and watch them. It is wonderful and beautiful. And this life we have is a gift. Wasting your time fretting and worrying about something that you have very little control over is not making your life better. So please, please be safe, be responsible, but find ways to be happy and to nourish the parts of your soul that you love instead of the parts of your soul that make you afraid. Be well. Let us know if we can do anything.